I am a parent of a 10-year-old and a 13-year-old. So the 10-year-old's unvaccinated. They started school on Thursday. I was worried, and I'm worried, and so I'm here to talk about masks for kids. I know masks have been somewhat controversial, but let me briefly explain that masks work not by sieving, but by filtration. Early on, I saw a photo somewhere on social media showing, oh, well, masks don't work. Look, this bird can go right through, but that's not how a mask works. A mask has multiple layers. You have to shrink yourself down to the size of individual fibers. And now if I'm the road runner, even if I'm a very small road runner and I have to get through this fast, this is a big obstacle course. And I'm going to end up crashing into one of those fibers or one of those fence wires. There's lots of misinformation out there about masks. It's saying that they're harmful for children or they don't work. The fact is that they do work. You can't get around the physics of it. Masks have been shown to work in schools. This was a large study involving over 500,000 households. And the way to read this is that things below 1 on the odds ratio, y-axis, indicate that there's reduced risk. Things above 1 indicate that there's increased risk of having COVID-like symptoms. So this was looking at schools and different interventions that they made. The more interventions, the better. And you can see that masking did help reduce the risk of having COVID-like symptoms, especially if teachers were masked. Now, this was before people were vaccinated. So Delta, as Dr. Prather explained, is much more contagious and requires better masks. Here are the priorities when choosing a mask. One is comfort. If your kid won't wear it, then it's not helping at all. Second is fit. Any leaks around the sides are like having a hole in your mask, and aerosols carrying the virus can get right through. And the third is filtration. These are all important, but I've put them in order. Now, on the far left-hand side, I've shown a couple of options. One is CDC's study showing that double masking does help protect the wearer. The best way to do that is to wear a surgical mask, which acts as a very good filter, but doesn't fit well, underneath a tight-fitting cloth mask, which helps hold down the edges of that surgical mask, giving you both fit and filtration. There's been some discussion about N95s for kids. N95s are not made to fit kids. They do not come in kid sizes, so I do not recommend N95s for kids. There are some alternatives, the Chinese and Korean versions, which are a KN95 and a KF94. They have similar filtration capabilities, and they are designed to fit closely to the face and to minimize leaks. Some of those are being made in children's sizes now. And then finally, there are masks, cloth masks that include a built-in layer of filter material that is very high performing. Some of these filter out more than 99% of particles, and those are also can be very effective if they fit well. There is a new ASTM standard for barrier face coverings, and there's 2 different levels, level 1 and 2. What the manufacturer has to do is to have their mask tested for filtration efficiency. They will report that number. You should look for a higher filtration efficiency. They will also report the breathability, and there you're looking for a more breathable mask, and they can also describe something about the fit. And we have created a document shown there. There's a link at the bottom, tiny URL, BT Kids Masks, which contains more information like this and a list of masks that we have identified that fall into this category on the right, where they're cloth masks with built-in good quality filters. And we also list those that have undergone the ASTM certification, gone through that process, or report that information. We have not compiled a list of KN95 and KF94s for kids. Those appear to be widely available, but you do need to watch out for counterfeit ones that do not perform as well. I wish I could give you some reassurances about which ones are genuine or not. I know that NIOSH has a list of that for adults. I'm not sure what the status is for kids. Thank you very much.